Hi, everybody, and welcome to part 8 of our 10-part lecture series covering the GI unit for those of you studying for USMLE Step 1 or COMLEX Level 1. Today, we're going to talk about the pancreas. So starting with anatomy of the pancreas, I'll go over some of the regions. This highlighted in red is the head of the pancreas. The only thing you have to know about the head of the pancreas is that a lot of pancreatic cancers arise in this region, and this can block the pancreatic duct and cause obstructive jaundice as well as the bile duct. The uncinate process is located here, so it's part of the head of the pancreas. You also have the neck, the body, and the tail of the pancreas. Moving on to other relevant anatomy and how the pancreas connects to the gallbladder and liver by way of these bile ducts. So let's go over that. Here at the top, you have your right and left hepatic ducts. What these do is they drain bile that's created by the liver. Those ducts will drain into what's called the common hepatic duct. And so that's a confluence of both of the right and left hepatic ducts. You have the cystic duct over here that connects the gallbladder to the common bile duct. And speaking of the common bile duct, here it is. It's a formation of the cystic duct and the common hepatic duct. Now on your screen highlighted is the main pancreatic duct. And so this is because of the name, the main pancreatic duct is our primary pancreatic drainage. This can connect, as you can see right here, it connects with the common bile duct. And so from this point on, you'll have not only bile and not only pancreatic enzymes, but a combination of both flowing through this region. I've also highlighted an accessory pancreatic duct right here, and it's a secondary drainage system, which is not connected to this bile duct. There's two papilla you have to know. The minor duodenal papilla is the region of the duodenum that can drain the accessory pancreatic duct. So our accessory duct right here can drain out the minor duodenal papilla. We have something called the ampulla of Vater. And this is right here at the distal end of where the common bile duct and the pancreatic duct drain. And it widens here. That's why it's called an ampulla. Ampulla is like a widened vase that people used to drink out of. And so it widens here, and that helps to increase the outflow. And last thing, we have our major duodenal papilla, and this is what drains the main pancreatic duct and also drains bile that came in from the common bile duct. At that papilla, there's something called a sphincter of Oddi, and this is a muscular layer that surrounds that duodenal papilla. And this can regulate outflow and prevent reflux. So it can, depending on whether it's open or not, it'll determine how much fluid can drain from this region into our duodenum. Something you should realize is that morphine can actually cause sphincter of Oddi spasm. And so there's some old theory that you should avoid giving morphine for pain in pancreatitis, because then you'll spasm your sphincter, which could actually worsen it because then the pancreas couldn't drain out. This has been a point of contention for many years, but you might get pimped on this. I don't think I've seen this tested, but I have seen a lot of attendings mention this, especially on surgery rotation. So talking about hepatobiliary function, we'll go through exactly how bile and the pancreatic duct works. So the first thing that'll happen is liver creates bile, and this bile gets sent to the gallbladder. Once the gallbladder is stimulated, and it'll contract, and then that bile can flow down the common bile duct. Well, actually, we'll go in order. Cystic duct, into the common bile duct, goes through the main pancreatic duct, goes in the ampulla of Vater, and into the duodenum, out that duodenal papilla and the sphincter of Oddi right here. And so you'll get bile in your duodenum. While this is all happening, you have pancreatic enzymes that are getting secreted into both the main and accessory pancreatic ducts. And then these two can flow out that same outflow tract and into the duodenum. There's not too many embryologic conditions with the pancreas, but we'll go over those right now. I want to go over normal pancreatic development, and then we'll talk about two conditions, annular pancreas and pancreas divisum. So starting with normal pancreatic development, the pancreas is derived from your foregut, and it starts as two distinct buds. So these buds are in completely different locations, and then they'll end up fusing. You can see we have a ventral bud here, and we have a dorsal bud here. So our ventral bud will end up giving rise to our uncinate process and our main pancreatic duct. Whereas our dorsal bud will be the other part of the head of the pancreas, as well as the neck, body, tail, and accessory pancreatic duct. And that's located here. And so normally during normal gut rotation, this ventral bud will rotate and fuse with this dorsal bud, and you'll have one pancreas. So it'll rotate, and boom, you got one pancreas, and there's your uncinate process right there. Everybody's happy. In annular pancreas, we have a problem with this rotation. So what's going to happen is that instead of rotating like it's supposed to all the way around here, it kind of gets stuck on the part of the duodenum, and it'll actually rotate it. So this is how it's supposed to be. This is perfect. This is not annular pancreas. And in annular pancreas, what's going to happen is it'll get stuck on this part of the duodenum, and as it rotates, it'll just constrict it even more, and you'll have this ring of tissue surrounding your duodenum. So what's going to happen if you have that is you could be asymptomatic, depending on how badly this constriction is, but you could get bowel obstruction because now you have a layer of tissue constricting your bowel and potentially compressing the lumen of your bowel. And so that can cause vomiting because of that bowel obstruction. You could also get feeding intolerance for all the same reasons. If food cannot travel past this section here, you're basically dealing with a bowel obstruction and you can't absorb nutrients as you need to. And that's because, like I said, if you have things coming in here down the duodenum, you're going to get an impaction right here. And here you can see it again here. It's at the second or descending portion of the duodenum. And I talk about this in our small intestine lecture. You can have this ring of tissue that's just constricting everything, and it won't allow food to get through this area. The last condition we need to talk about is pancreas divisum. So pancreas divisum, just to give you an idea of when this whole rotation happens in this fusion, it usually happens in about 8 weeks. And a good mnemonic to remember that the pancreas ventral and dorsal buds combine at 8 weeks is using a pictorial mnemonic. If this is our ventral bud and this is our dorsal bud, just remember that they attach here at 8 weeks. You can see the letter 8 there forming. In pancreas divisum, though, there's failure of bud fusion. So normally we have our pancreas rotating and you have a perfect pancreas right here. But in pancreas divisum, you can see that they are two distinct parts. And what's going to happen in this case? So this case, most people are asymptomatic, but you can get pancreatitis from this. Why is that? Well, remember that we talked about before, the ventral bud, which becomes this one right here, this gives rise to not only our uncinate process, but more importantly, our main pancreatic duct. So this is the duct that is supposed to be draining most of our pancreatic fluid. In this case, if this entire region here is only able to exit through that small accessory pancreatic duct, you can easily get blockages, or you can easily have a backflow of pancreatic enzymes that get stuck in your pancreas and cause inflammation. So this whole region has a lot of responsibility now. That accessory duct has a lot of responsibility, and you can get pancreatitis if there's any problems with that. Thanks for watching. I hope you enjoyed the video. Please like, comment, and subscribe for more content.